Good morning, everyone. Since I'm subbing for Dr. Adler, I'll try to start on time like he would in the interest of all of you who've shown up on time. The title of our talk this morning is Pediatric Acupuncture, What is the Point? And our speakers, and there are two, their names are listed on the board. The second half of the program is Dr. Brandon Horn, who is a PhD and a JD and is a doctoral level acupuncturist and practitioner of traditional Chinese medicine. He is a professor at the Yosan University of Traditional Chinese Medicine. He's also on the faculty of the Geffen School of Medicine at UCLA. He's authored a large number of publications in the area that he's going to be talking in this morning. So with that, Jeff, I think you're going to lead off.
So it is, I'm going to bring up Dr. Horn now, and he's going to present some of the scientific literature on acupuncture.
Okay, so we're going to talk a little bit about how acupuncture works, not from a Chinese medicine perspective, because that would take way too long, but from a Western perspective a little bit, because we don't quite know how it works, so it's a little easier to do. But to me, in presenting this, one of the more interesting areas of research, because acupuncture seems to have a wide range of physiological activities, and how do we go about explaining all of these functions? And one of the areas that's been looked at has been in the area of brain imaging. And so when they're doing, especially in functional MRIs, they've shown that acupuncture points, many of them have site-specific modulation of the brain in terms of its fMRI responses. So for example, in this study, stimulation of acupuncture points, these were actually on the little toe, and these are traditionally related to vision. They activated the visual cortex with a specific modulation effect. Another example, in functional dyspepsia patients, acupuncture induced a glycometabolism decrease in the postcentral gyrus and the cerebellum. In terms of what we can identify, changes in the bloodstream, things like that, that we can say, okay, here may be another way physiologically that acupuncture is producing certain effects. There's been quite a lot of interest in this, so we're going to just sort of do a smorgasbord of things here, just to give you an idea of some of the research that's been done. The first, which is really a broad-reaching category, would be anti-inflammatory and immunomodulating effects. So acupuncture was shown to inhibit nuclear factor kappa beta DNA binding and IL-6. It is a cyclooxygenase 2 inhibitor, so kind of like Vioxx, but without the death. It was shown to increase serum superoxide dismutase levels, downregulated both serum and colonic TNF-alpha, and it inhibits toll-like receptor 2 mRNA and the 2,4 protein expression, as well as pro-inflammatory cytokine expression. Very interestingly, adrenalectomy did not block the effects. So if you're giving your patients corticosteroids and you need a little bit of a kick to it, then acupuncture could potentially be something you want to think about, because it's not necessarily going to add to the cortisol burden of the body. And in fact, we'll see a little bit later that acupuncture can also counteract some of the side effects of corticosteroids, and so it can allow you to use higher doses as well for obviously greater efficacy. It was also shown to decrease the oversecretion of vasoactive intestinal polypeptide, substance P, and mast cells, in this particular study reducing diarrhea predominant IBS. In endocrine, we just presented there yesterday, so this is a really shortened version. They showed for Graves' disease it could decrease thyroxine. It is an insulin modulator, so it can increase insulin, but at the same time it can reduce insulin. So this is something that we're going to see as a repeating theme. Now, they've done studies, for example, where there's a point on your ankle. They stimulate that point and it activates the sympathetic nervous system. And there's one on your wrist that if you stimulate that point, it activates the parasympathetic nervous system. If you stimulate both of them simultaneously, it doesn't activate either of them. They cancel each other out. And so this is really important to understand, because when we're looking at studies and a study says that acupuncture works for this particular thing or doesn't work for that particular thing, then we have to ask ourselves, well, what protocol were you using? What points were you using? Because, you know, by just adding one point, you can change the entire function of that particular treatment. And so that's one of the simultaneously liberating and frustrating aspects of acupuncture research. Okay, neuropsychiatric modulation was shown to reduce stress levels, increases serotonin and acetylcholinesterase expression in the hippocampus, obvious ramifications for depression, increasing nocturnal melatonin levels, ramifications in insomnia and so forth. And interesting, upregulated hippocampal somatostatin and somatostatin messenger RNA. The interesting thing, so for example, you would say, well, this may cause problems decreasing growth hormone, but there are other studies showing that it can increase human growth hormone secretion, and so we may be we're looking at different points, so you don't have to be confused by seeing all these, seeming contradictions in the literature. Increasing neuropeptide Y, decreasing substance P, increasing plasma beta endorphin, and reducing cortisol. And again, increasing cortisol in other studies. Hepatorenal protective effects. Obviously, this is very important for a wide variety of therapies that we provide here at Children's Hospital. So in studies where they damaged the liver of rats with carbon tetrachloride, acupuncture showed a protective effect. It was shown to decrease ALT, AST, GGT, triglycerides, and total cholesterol, and it was shown to have a significant positive effect on non-alcoholic steatohepatitis. Renal protective effects, it was shown to decrease serum creatinine and BUN, helped reverse ethylene glycol-induced renal damage in dogs, attenuated the progression of renal disease, and increased the GFR. Again, here we talked about, before we already mentioned the human growth hormone, and this obviously has ramifications when we're using corticosteroids in young children, since that can inhibit growth. Modulation of Th1, Th2 also has a very broad applicability. Acupuncture was shown to help increase IL-2 and gamma interferon, decreasing IL-4 and IL-10, but at the same time, if you use other points, as you can see, it can enhance IL-10. Also was shown to increase ERK1, 2, P38, NF-kappa B, and AP1. Decreased serum levels of antigen-specific IgE and total IgE by suppression of IL-4 and IL-13, obvious ramifications for allergies. Also was shown to increase glutathione levels, so it can protect many systems from oxidative stress, oxidative damage, and glutathione obviously also supports Th1 cytokines. Was shown to decrease leptin levels. Interestingly, obese patients have high circulating levels of leptin. It seems that they develop a leptin resistance, so acupuncture may work by improving leptin sensitivity. At the same time, there are other studies showing that acupuncture can increase leptin levels, which would be something that would be sort of more obvious in terms of its effect in being able to suppress appetite. Increased superoxide dismutase levels in RA patients specifically in this particular study. Low levels of SOD correlate with increased disease activity. Increased salivary flow rates for Sjogren's, for example, downregulated both serum and colonic tumor necrosis factor alpha. Okay, so all of those are mechanisms. We talked a little bit about their applicability. So here are some of the common medical conditions that they've looked at. And again, this is sort of a smorgasbord here. But in GI, for example, there was a systematic review. Acupuncture improved the quality of life in all forms of IBD studied. It was shown to improve IBS, improve functional dyspepsia, ulcerative colitis, pancreatitis, achalasia, gastroparesis. In immunological disorders, in asthma, for example, they showed a reduction in asthmatic symptoms that were accompanied by changes in the blood work, the reduction in tumor necrosis factor alpha, and an increase in gamma interferon, IL-6, IL-4, and IL-2. In this case, there were 30 acupuncture sessions delivered, so this is not, a magical treatment where it's one treatment and poof, everything is all better. We need to do a bit of work here. So when you're referring, we like to see some concrete results within 12 treatments. Oftentimes, we'll see things, concrete sooner than that. But again, you should have an idea of how many, treatments before expecting some kind of results. And obviously, it's going to depend on the condition, the severity of the condition, and so forth. Sinusitis, rhinitis. Interestingly, they actually did a study where they did scalp acupuncture, and they were able to desensitize people to certain allergens by using that. So that's an area that has quite a bit of interest right now. Okay, so in RA, 14 sessions in this case of acupuncture produced statistically significant improvements in the DAS-28 pain and global activity, swollen joint count, health-related quality of life, and the ESR. In osteoarthritis, and this is going to be a recurring theme that we have, acupuncture and conventional therapies have equivalent efficacy. However, when combined, the results are superior to either alone. And that's really our experience at CHLA. We work a lot, and because we sit in the rheumatology department, we also work a lot with rheumatology. And, they've controlled the disease process. So when we're going in and doing acupuncture and, getting this change and that change and what's left over, it's really because of a combined effort. That's not necessarily something that's going to happen unless the actual disease process has already been controlled. So really, this time we get really phenomenal results, and there are several case studies that are going to be submitted for publication based on some of the things that we've seen there. Fibromyalgia is another one, in this case 20 sessions, and results after 20 sessions lasted for up to a year. Lupus, while there's insufficient data, I'm just mentioning this because the 3 case studies that we have were in patients with lupus, and the results were quite dramatic even with one treatment. Acupuncture and neuropsychiatric conditions, clearly spelling is not one of them that it treats. Anxiety, I could use some of that right now. Acupuncture improved anxiety disorder in a meta-analysis. Acupuncture and midazolam were similarly effective for the treatment of dental anxiety. In depression, the therapeutic efficacy of acupuncture was equal to that of amitriptyline for depressive disorders. Acupuncture increased nocturnal melt. We talked about the treatment of insomnia and anxiety with melatonin. It attenuated stress-induced defecation in rats. And this is really interesting because if you guys have rats with these kinds of problems, acupuncture is the treatment of choice. Acupuncture improves restraint, stress-induced delay of gastric emptying. Okay, FAQs. Does acupuncture hurt? Like anything, depends who does it. But in general, at CHLA, we use such small needles that the patients don't feel them. They literally don't even know that we've inserted the needles. So the way that we do it here, it does not hurt. How big are the needles? Again, we talked about that, 38 to 40 gauge, so almost nothing. How many treatments? We talked about that. It just depends on the condition. Do we reuse needles? Never. They're all single-use disposable needles. Are the effects only temporary? It depends on the condition, like pretty much anything we treat, or any of us treat. Do you have to believe in acupuncture in order for it to work? Many of the studies were obviously done on animals, and so unless you can convince me that the animal where we came in and injected them or whatever with carbon tetrachloride to dissolve their livers, then they're going to believe we're going to come back to them with a needle that's going to cure them. Clearly there's something beyond just belief that's happening. Obviously, there is placebo effects involved in any treatment, and acupuncture is no exception to that. So belief will have some effects. Can we treat everything? And again, this is why I wanted to bring up the fMRI research, because acupuncture seems to have effects on so many different systems. But do we cure everything? Absolutely not. Can it potentially be an adjunct to many different conditions? And the answer to that is yes. It's very useful. We should keep in mind that it was used as a primary healthcare modality for thousands of years in China. So they were trying to figure out, if all you have is a hammer, you've got to figure out how to do everything with a hammer. So that's essentially what they did. So